respected Dr. D.K. Das, former DGRHS and today's chief guest, Dr. Anjan Datta, the president of ISA, Sri Pramod Kumar, AGM Southeastern Railways, Dr. Swain, CMD Southeastern Railway, Dr. Upasni, Dr. Sharma, Dr. Nima, Dr. C.R. Panda, my colleagues, Dr. Arvind, Dr. Reena, Dr. Das Gupta, Dr. Sen Gupta, Madam Rashmi Verma, Mrs. Das, all the delegates, colleagues, ladies and gentlemen. The Railway Forum of Indian Society of Anesthesiologists is indeed standing on its firm feet today by entering into its adulthood, having completed almost 18 years of its existence, due of course to your combined efforts of the worthy members of this association and the efforts of our former stalwarts like Dr. Upasni and Dr. Pawar and Dr. Srivastav, without whose mention I will not be comfortable. I, as President of this lively society, welcome all the delegates and honorable guests to the 18th Annual Conference of RFSIA and 33rd Annual CME of Southeastern Railways in this city of joy, the cultural capital of India, the past capital of India till 1911 and the capital of modern medical science in India, because the science started in India, the modern science started practically in Calcutta. Calcutta has been the center of development of modern science in India, as the British East India Company established the Indian Medical Service in as early as 1764 to look after the Europeans in India, and the IMS officers headed the military and civil hospitals, including the railway hospitals of those times in Bombay, Calcutta and Madras residencies. Apart from IMS, the government had laid down a plan for establishing a native medical institution also in Calcutta itself in 1822 by imparting medical education in their vernacular language so as to induce Indians in this prestigious medical service. This NMI was abolished in 1835 after establishing a medical college, Calcutta Medical College, which was opened in 1835. So that was the first medical college to be opened in India, if I am not wrong. Dr. Madhusudan Gupta is often given the credit of having dissected the first human body in Calcutta itself in 1836 in Calcutta Medical College, along with his 4 or 5 colleagues who are Indians. The Calcutta has also the credit of introduction of modern anesthesia in India, as James Esdale started mesmerism in the Imambada Hospital, Hooghly, Calcutta in 1843 and published 216 papers, operations, well before the ether anesthesia was introduced to the world. And incidentally, the first administration of ether anesthesia in India was also practiced on 22nd of March 1847 in Medical College Hospital, Calcutta, just after 157 days of its first introduction to the world by W.T.G. Morton on 16th October 1846 in USA. Similarly, the first chloroform anesthesia in India was administered on 12th of January 1848, just after 58 days of its first use in UK by Simpson on 15th November 1847. So Calcutta is full of history of medical science, including anesthesia, and we are proudly holding this conference this year in this beautiful location of Southeastern Garden Ridge. The theme of this conference has been rightly chosen as the Anaesthesia Newer Horizons. Safe Anesthesia Newer Horizons, as safety in anesthesia is of paramount importance. The hands-on workshop and the clinical discussions on the various topics will definitely bring out novel ideas and techniques to enable us to serve the beneficiaries still better and in a more safe way. It is my strong desire that we always try to make anesthesia practice more and more safe by rigidly following the guidelines of our national body as well as the RFSIA guidelines which have been published recently. We should strive hard to upgrade our operation theatres by timely placing the demands for equipments and devising our own systems of proper record keeping for every patient, as each case in anesthesia is a potential medico-legal case, even though it may be a minor case for a surgeon. I earnestly request all our colleagues to be life members of this association and also actively participate in the activities of this forum by presenting papers at various levels, state levels or national levels. I take this opportunity to wish the organizers of this conference a grand success and hope that the flag of RFSIA will still fly higher in the days to come. Thank you all very much.